Hi, hello, welcome back. So today we'll be seeing about electrophysiological operative procedure code series 33250 to 33266. This is a topic which is coming under cardiovascular CPT coding. So we have added a playlist for CPT coding. You can have a view on it. So definition for this is electrophysiological operative procedure involves intervention to diagnose, treat and manage electrical conduction issue of the heart. These procedures are often related to arrhythmias, abnormal heart rhythm, and may include device implantation, lead insertion and other corrective surgical measures. So the CPT code for this is 33250 251 254 255. Please read the description of each code to properly understand. So the codes are with cardiopulmonary bypass and without cardiopulmonary bypass, like that differentiation is given. So have a view on it. Next is 33256, 33258, 33259 and 33261. So read the procedures very carefully. Here in 33256 it is with maze procedure and valve surgery. Like that you have to read the description for clear understanding. And next 33263, 33264, 33265 and 33266. This is also like with the maze procedure, coronary artery bypass and valve surgery. Like that each code have their own description. Please read it. Example, case of atrial fibrillation with coronary artery disease. A 67-year-old male with atrial fibrillation and coronary artery disease. Procedure done here is operative ablation with maze procedure and coronary artery bypass. So the CPT code given here is 33258. And second example, a 58-year-old female with atrial fibrillation and mitral valve prolapse. Here the procedure is operative ablation with maze procedure and valve surgery. We are giving 33256. And example 3, case of atrial flutter with cardiomyopathy. A 60-year-old male with atrial flutter and cardiomyopathy. Procedure done here is operative ablation of arrhythmogenic focus with cardiopulmonary bypass. Code series 33250. Example 4, case of ventricular tachycardia with previous CABG. A 72-year-old male with ventricular tachycardia and previous CABG. Procedure done here is operative ablation with maze procedure, coronary artery bypass and valve surgery. Code series 33263. And example 5, case of atrial fibrillation with atrial septal defect. A 55-year-old female with atrial fibrillation and atrial septal defect. Procedure done here is operative ablation with maze procedure, CABG and atrial septal defect repair. So here we are giving 33264. So tips is understand the components, that is with maze procedure, other surgical techniques associated with arrhythmia correction, and detailed documentation like whether the procedure is documented including cardiopulmonary bypass, valve surgery and any other additional thoracic procedure. Code combination we have to check. That's all about this. Conclusion: electrophysiologic operative procedure or complex intervention designed to manage and correct arrhythmias. Accurate coding of these procedures require a thorough understanding of the surgical technique involved and specific components of each procedure. Thank you so much for watching. If you have any doubts, you can put it as a comment. And if you haven't subscribed, please do subscribe and share it with your friends also. Thank you so much for your time. Take care. Bye-bye.